Hi, Dad. So my name is Dr. Ravikumar Ravindran. I'm a consultant diabetologist and endocrinologist in the UK. I have undergone comprehensive training in the subjects of diabetes and endocrinology, and I've had nearly 5 years of experience as working as a medical and a endocrinologist in the UK. The pride of being in the medical profession was instilled when I was young by my father. My father was a consultant pediatrician, and he was very well respected in the community. And I was a very great admirer of his work ethics and his dedication towards his patients. And all these things made me want to become a doctor early on in life. He was my role model, and I also got to see the first hand the gratitude the patients had for him. And so this made my decision to become a doctor very easy. So very early in my career, when I was doing my clinical internship, I knew that I would be a clinician rather than a surgeon. And I think you get that feeling when you start seeing patients and you understand yourself. So I knew my path was going to be a clinical path as a physician. And what I enjoyed most was getting the history from the patients, examining them, and requesting the right investigations. And also, I was very keen to understand the pathophysiology of the many diseases. And diabetes and endocrinology as a specialty helps you do that. It has got a whole holistic approach to medicine, and so I feel it's a fantastic specialty, and uh, it also helps to me to understand the connections between the various organ systems better. So these were the things which made me choose this specialty. The main thing is a very holistic specialty, and we have a very rounded view about the patient's diseases. So diagnosing, treating the patients, and finally uh, seeing the joy in the patient's eyes after we diagnose and treat a condition. Those are the ultimate uh, rewards of the job. It's very, very satisfying. Patients deeply value us clinicians listening to their concerns, and also being very open and honest. There can be a lot of challenges during the process, like investigations, especially in my field, where when you do tests for hormones, hormones can fluctuate a lot. So you might do repeat testing. And so it's very important that you develop a bond with the patients. And it makes the journey built upon trust uh, and understanding more endearing, and for both myself and my patient. So it's basically getting to know the patient and knowing what they want and trying to give your best to the patient care. Whenever I see a patient, I tell them uh, in a very honest way that I try to get the history, try to listen to them, listen to the concerns, and then give my very honest opinion. Because there's always, as a in endocrinology, there's always a tendency to put the blame on hormones very often. But sometimes it's just not the hormones, and all investigations might come back as totally normal, which is very good for the patient. So it's speaking to the patients in the right context, and giving them the right information, and hoping that they understand. So those are the things mainly. No, I don't have any particular catchphrase. What I tell my patients is that I tell them that they can expect total transparency from me, and and my total professionalism. And also, I will not and if there's opportunity for me to discuss with my colleagues, if I'm stuck on a patient, I'll be more than happy to discuss with my colleagues to get the best for my patients. So it's all about being open, honest, and trying to do my best. And in return, if I can do something better for my patients, it's worth it. It's worth in gold. Thank you.